a little bit about what was going on in ASRA when you took over as president. Were there any big controversial issues that you were dealing with?
Yes, to look back, when I became president, that was a time that we went through a very tough time in our society. Obviously, a lot of people don't know about it. The members don't know about it. We don't talk about it. That was a time that we were changing management. Also, at the time, we just let go of our executive director. So we had to find another one. The big decision is whether to stay with our current, at the time, the management company, or to find someone else. And my decision was to stay with ASRA and to take the time to look for a new executive director. So it took a lot of time and energy to interview and many candidates and try to find the right person. So that was the challenge at the time. And the other things I've noticed during that time is we don't have enough resources. The office was really made up of one person, the executive director, and also one person look after the annual meetings, and only one part-time staff. Is really not much support in the office. So I was trying to build that up and trying to find money to support that. So that was a bit of the challenge.
Yeah. Tell me, how did you become involved in ASRA? Who brought you to your first ASRA meeting, or how did you get to that first meeting?
I believe that was when I first started coming to the ASRA meetings when I was a fellow at the Women's and Brigham's Hospital. Okay. And at the time, Dr. Cavino was the chair, so I just followed along. And at that time, obviously, I was interested in regional anesthesia and pain medicine, so I started the fellowship there, and then started to do some research and had the opportunity to present my research work, and so that's why I came. And he was the boss, and Dr. Cavino was very supportive and encouraged us to get involved.
Who do you consider your mentors?
My mentor, looking way back, it was a obstetrical anesthesiologist in Toronto when I was a senior resident, and she mentored me, and she was the one who really lead me into research. She was the one, I still remember the first research study I did with her about shivering after epidurals for cesarean section. And then for regional anesthesia, I think there are so many people along the way. Dr. Michael Ferrante at Brigham, he was my attending at the time, so I learned from him. I still remember how hardworking he was, because at lunchtime he would grab a sandwich and work in front of a computer, and we always talk and try to find new ideas to do research. So at the Brigham, another one that is really, as my clinical mentor, is Dr. Mercedes Concepcion. She was really good to me, and learned a lot from her as far as regional anesthesia techniques goes. Yeah.
How do you feel about being the father of ultrasound for regional anesthesia?
Well, the first thing I must say is I don't acknowledge that.
But everybody
I was
else
just
does.
one of them, one of the people who started. I always give credits to the group in Vienna. They were the first to start using ultrasound. And in North America, I think, yes, I am the early group of people who look at ultrasound. So I think it's good. I think what I truly believe in is if something is good, you try it, you use it, and then you teach people, and then let them decide. If it's something good, people will see it, will follow it. So I'm happy that people agree with me, and we it's so much fun because this is now like a family. Whenever we go to meetings, we talk about this and share experience, what works, what doesn't work. So I'm happy. I'm very happy about that.
Good.
One thing I believe in is we need to continue to innovate. So this is just one good tool that we're using. And the next thing is, what is the next tool, right?
What do you think the next tool is?
I don't know. I do not know what the next tool is. I don't believe it is just a machine or a technology. I think it's how we look at things. How we look at things and how do we apply what we have, what we learn to better the care for our patients.
Sure.
But as far as ultrasound goes, I think the next phase is for me very clearly how to use ultrasound for the perioperative applications. How to use that technology to look at the heart, to look at the lung, look at other areas, and so that we can be a better physician. It will be an extension of our physical examination. So that is actually what I'm doing now. Is I'm learning.
Okay.
I'm continuing to learn how to use it for lung ultrasound, echo, and other things. So it's a fun journey. I think we'll see a lot of changes in how we apply ultrasound in anesthesia care. Things will continue to change. I don't believe it would be the same thing. So what we consider very important in the past, paresthesia techniques, nerve stimulation, and now ultrasound, maybe 50 years ago, 50 years later, we won't even talk about them. And my dream has always been maybe in the future we don't need local anesthetic to provide surgical anesthesia. There will be another technology. I don't know what that is. So, everything has its role for that time period, but I'm not so sure there will be one thing that will be everlasting. I think what we need to learn is continue to change with time and to adapt our knowledge and our skill to care for our patients. Well, one thing that is very dear to me and I try to improve is the transparency of the society so that people do know who we are, particularly at the leadership level, to know that we are no longer is a closed, old boys club and they're not open to people outside to join the society, both at the committee levels and also at the leadership. So I hope people have seen that change and we continue to improve on those things. And I think that's good, so that we have new blood, younger people come in. I think that is very important. And the other thing I also really feel that we should work on, and I have already seen improvement, is to build the infrastructure to how to carry out the important tasks within the society. So now, this is history. This year is the first year that we have ever managed a meeting all by ourselves by in-house staff. This is brand new. So we have developed infrastructure. We have succeeded so far. And we'll continue to build on it because by doing that, we can do a lot more for our members. The educational and also research activities. So we must focus on the vision and the mission of the society to advance the education, the research, and the science of regional anesthesia and pain medicine.